Welcome. Today we have Dr. Srinidhi Bhatt, a pediatric dentist who has more than 10 years of experience. So, doctor, we have few questions from parents. So, I would like to ask.
Thank you, Rahul. Well, thanks for having me on your podcast today. And there'll be an absolute honor for me to answer all the questions what the parents have for me. Please bring it on.
The first question is, when should a child have their first dental visit?
Ideally, you asked me the textbook, we follow something called AAPD Guidelines, American Association of Pediatric Dentistry, which suggests that your first visit of your child should be 6 months or when the child gets the first teeth. Worst case scenario, at least before the first birthday.
Okay. So, doctor, what if a child get his teeth after 1 year? Still they have to visit?
See, ideally, it is quite common nowadays to see that the teeth comes after a year also. Okay. I've seen kids getting their teeth till 2 years of age, their first teeth. In them, I would suggest to make sure you visit the dentist so that we can tell them how to take care of the gum pads, the soft tissue before the teeth erupts, how to take care of that so that the bacteria which causes problem in the mouth is kept under check.
Okay. So, doctor, how often a kid should visit a dentist?
Ideally, after the first dental visit, once a thorough examination is done, we would tell the parents the caries risk of that child. If the child is caries active, if he has many cavities in the mouth or he has a tendency to develop more cavities, we tell them to come every 3 months. But if we know that the hygiene practices are done very, very well, we would say come after 6 months. Okay. Every 6 months is the ideal recall.
Okay. Doctor, one more question, like parents say baby's teeth are about to fall, then why should they?
To maintain?
To maintain.
So ideally what happens is God has given you this teeth for a reason.
Okay.
Right?
Yeah.
God is definitely much smarter than us.
Correct.
So He has given it for a reason. At least as human beings and dentists, pediatric dentists, we have found out some good reasons to maintain it. One is basic nutrition. When the child bites, they eat through it. So the teeth are needed to biting. Second is milk teeth. They act as a guide for the permanent teeth to come out. The new permanent teeth are forming inside the bone in the same child. So this milk teeth acts as a guide. Third, it helps in phonation, speech. Fourth, psychological issue. Now you have a child without a beautiful teeth. This is an era of podcasts, this is an era of Instagram and so much of social media. Yeah. Without a beautiful face, it's difficult to survive, isn't it? There's a lot of peer pressure outside.
Correct.
So in order to have a good psychological impact, you need to have good teeth. Even the milk teeth help the child to have a good psychological impact on the world.
So I have a follow-up question on that. Basically, when do kids start losing their teeth?
Ideally, on an absolutely ideal scenario, we start seeing that the lower front teeth would shed by about 6.5 years and the upper front teeth by about 7.5. And all the back ones, which are the milk teeth again, they would shed by the age of 12 or 13 years depending on the age and the sex of the baby. So the girl child would lose it a year earlier and a boy child might lose a year later. All said and done, these teeth are going to shed till 12 and 13 years. Until then, they help the child in chewing. So basically helps in major nutrition of the child also.
Okay. So is that like difference is for boys different, girl is different? Like?
Yes. Girl child might hit a growth spurt earlier, whereas a boy usually hits a bit later. You might have seen two kids who are of very similar age or in the same class, two kids are there where the girls tend to look tall by the age of 7 and 8 and the boys tend to look shorter. But suddenly you grow past about 2 or 3 classes, suddenly see that boys are much taller and the girls are still in that same height. Yeah, this is the reason that growth spurts work.
Okay, it's very interesting. Another question is from parents, like they are telling that kids are not doing brush properly. So in that case, what should they do?
I'll put a counter question to you, Rahul. How many times do you brush in a day?
Usually once in a day.
See, that's the problem. Now, you are not brushing more than once a day and you expect your child to brush twice. How is that? Fair or reasonable also?
Correct.
Ideally, what we say is, in kids who are quite tantrumous in brushing, make your brushing and hygiene practices a fun practice. Like give them a timer, saying set the timer for 2 minutes and tell them to brush their teeth, or make it a jingle, like brushing your teeth with a nice song which they love to hear, and you brush along with them.
Correct.
So you make them walk through the process of brushing since childhood, so that they develop this habit since the childhood, so that As they grow further, they feel it's a normal routine without causing trouble to them.
Correct. It's like basically in the starting they will feel trouble, like no, I don't want to do. They just try to avoid this thing
Exactly.
in the starting, but once it is a habit, like they can
They get used to it. So basically, it's like bathing. Now, every day since your childhood, your parents have made sure that you bathe every day, right?
Correct.
Same way, if you put the habit of brushing twice a day with flossing since the childhood, kid automatically takes it as a normal routine.
Correct. So, doctor, we have another one basic question: is thumb sucking harmful?
See, ideally, thumb sucking is developed at the time of birth itself, and it's a way of child to soothe itself on its psychological demands, right? It feels very comfortable for the child when it sucks his thumb. But if it is done beyond 2 years of age, then it has to be addressed.
Okay.
So we as pediatric dentists approach it post 2 years if it is continued. We approach it in different aggression with different age group in different modalities.
Okay.
So beyond 2 years, consider it as abnormal. The child has to stop it.
Okay.
And you need help, we are always there.
Yeah. Thank you. So, doctor, is fluoride in toothpaste safe?
Well, Rahul, this is a very debatable topic according to the layman.
Okay.
But it again depends on your understanding of the way fluoride works. And me as a pediatric dentist, I'm a staunch believer that fluoride is a fantastic tool or a fantastic medicine against cavities. Okay. So I always promote my patients and my kids to use a fluoridated toothpaste and not fall for the gimmick of non-fluoridated toothpaste, because fluoride is being researched since quite many years, where it has shown beneficiary effects when given in right dosages. And the toothpaste that's available in India, most of them are underdosed, not even the right dose, okay. Not higher. Higher is a different thing. They are usually underdosed. So I would prefer my kids, all my patients, or whoever is watching this podcast would promote using fluoridated toothpaste. Okay. And even to the point that we have a tendency of calling all our patients every 6 months for a preventive fluoride therapy. Like you vaccinate your child, you do vaccinate your child for different problems, right? Like yes. Measles, mumps, rubella, you do that, right? Similar way, this fluoride acts as a vaccine against the cavities. I'm not saying it will completely stop your cavities, but at least it would reduce the impact of it.
Okay. So, thank you, doctor. Moving forward to next question. So, what are the signs of cavity in the teeth?
See, ideally, signs of cavity would be a white color spot to begin with. And this spot, if not taken care, it turns into a brownish lesion, brownish colored cavity. Okay. And then a prompt black color cavity. Now, how do you find that in your child when you're brushing? If you see this white line or a white spot, you take care of it. You get them to a dentist, they will identify it for you. Or if the child is avoiding the food altogether, okay. Probably because of pain, probably because it might not like the food. Now, you can't judge what is it. Okay. You can't always say the child is not liking the food and avoiding it. Probably the child might have prompt pain, so he might be or she might be avoiding food. In such cases, make it a point you visit a pediatric dentist. We are always ready to help them.
Okay, thank you, doctor.
Well, thank you, Rahul. With that being said, I would want all the parents who have their doubts to put all your doubts in the comment section. And if you want to visit us, we are practicing presently in Jayanagar and Electronic City at ManDent Children and Family Dental Clinic. We are always open for all your questions and as patients also. Thank you.
Thank you, Dr. Srinidhi. That was really helpful and thoughtful answers. Hope our audience got all the answers for their questions, and thank you for being here.